Cardiac cycle. Cardiac cycle is also called heartbeat, and it is caused due to the electrical impulses which is provided by the sinoatrial node, which is present in the right atrium, and the AV node, that is atrioventricular node, that is also present in the right atrium but towards the atrioventricular septa. So, what are the different processes that happen in the cardiac cycle? So, first step is that all the chambers of the heart will be in a relaxed state. So, when the heart muscles are in the relaxed state, it's called as diastole. So, the first step is joint diastole, where all the chambers of the heart will be in a relaxed state. At this time, the left atrium of the heart will receive the oxygenated blood from the lungs. Left atrium receives oxygenated blood from lungs. And that comes to the left atrium through the blood vessel, which is pulmonary vein. Similarly, during this time, the right atrium of the heart also receives blood. The right atrium receives blood from the tissues through the vena cava. The right atrium receives deoxygenated blood. Coming to the second step, in the second step, the sinoatrial node, they generate action potential, or we can say electrical impulses. Action potential means the electrical impulses in the right atrium. So because of that reason, the atrium contracts, which is called as atrial systole. When the atrium contracts, the oxygenated blood, if it is in left atrium, that will pass on to the left ventricle, and the valve present is called as bicuspid valve that opens in order to permit the oxygenated blood to come towards the left ventricle. At the same time, the right atrium also contracts. So when the right atrium contracts, the deoxygenated blood passes from right atrium to right ventricle through tricuspid valve. So that's what happens when the atrium contracts. So here there is the tricuspid valve. Now soon after the blood reaches the ventricles, that is from right atrium to right ventricle and from left atrium to left ventricle, these valves, tricuspid valve and bicuspid valve, will close. They have to close in order to prevent the backflow of blood from ventricle to atrium. These valves will close. Now it's time for the ventricles to contract. That would be the next step. So third step will be ventricular systole. So when the ventricles are contracting, the atrium would be relaxing. So that will be atrial diastole. But now it is the ventricular systole. Now when the ventricles contract, it means systole means ventricular muscles will contract. The blood from the ventricles move towards the blood vessels. Now if the blood is from right ventricle, then the blood, deoxygenated blood, then it will be deoxygenated blood. The deoxygenated blood from the right ventricle passes into pulmonary artery, and oxygenated blood passes from left ventricle to the aorta. Now both the blood vessels, that is whether it is a pulmonary artery or the aorta, they have semilunar valves. So once the blood enters the respective blood vessels, the semilunar valves will close. After the entry of blood into the blood vessels. After blood enters the pulmonary artery and the aorta. So if you look at the diagram, so from the left ventricle, the oxygenated blood goes into the aorta. That branches and supplies the oxygenated blood to the tissues. And once the blood enters the blood vessel called aorta, the semilunar valves will close so that the blood doesn't flow back to the ventricles. Similarly, from the right ventricle the deoxygenated blood passes into the pulmonary artery. So the pulmonary artery has got deoxygenated blood. And it reaches the lungs for oxygenation. Once the blood enters the pulmonary artery, then the semilunar valves will close in the pulmonary artery too. After that, the cycle repeats. There will be once again a joint diastole where all the heart muscles will relax. So whatever happens, these events are collectively called as cardiac cycle.